Hello, it's Paula Nutting, your musculoskeletal specialist, and it's hard not to feel a bit bouncy with that little music that goes on through there. I always love it. I am very excited because this is our end of August, Ask Me Anything live stream information for all therapists out there. And I can't tell you how excited this will be for many people out there. I'm interviewing someone who is all about saving our longevity in the industry. I'm actually interviewing Lauriann Greene, who has been around, as she said, forever, and has written now her third edition of Saving Hands, which is ways for therapists to actually manage to stay in this industry for as long as we can, pain-free. So without any further ado, I would love you to come on board, Lauriann, and we can get this ball rolling and see how we can help therapists for the next half hour or hour.
Sounds good, Paula. Very nice to be with you this evening. Well, it's evening my time.
Yes, evening your time. It's 9:30 for us in the east coast of Australia, 7:30 for the poor old people over in WA, but that's fine. And it's terrible o'clock for the UK people. So this is always tricky to try to get a lovely balance for everyone around the world, which is such a pain. Anyway, yes. Not to worry. So I didn't know the background of you, Lauriann. You've got like so much industry experience. And I know we're on an isolated island down the southern, down, but that is terrible that I haven't seen you before. Can you please give people you don't have to do the elevator pitch, really like them to know what your background is. I saw that you were injured. There were some injuries after you.
I can, I'll try to keep it short because it covers about 35 years. So, I went to Seattle Massage School, Seattle, Washington, in the United States, which was an excellent program, a year-long program. And now this was back in the beginning of the 90s, so it's quite a while ago. And at that time, we really didn't talk about injury prevention. We talked about body mechanics. But I will make a point, which I will probably make several times during our time together. Body mechanics is not the same as ergonomics, and it's not the same as injury prevention. It's one of many strategies that is useful in preventing injuries. So anyway, I went to massage school, and being an A+ type person, I did an externship, and I took all kinds of extra workshops, and I suddenly increased the number of massages that I was doing per week. And that's a good way to get injured, that sudden increase. So I started having symptoms on the ulnar side of my wrist, pain, and it just got worse and worse. And I was able to graduate, and I was able to pass my state boards, but I was not able to practice. I was in too much pain, and I was in pain for 3 years.
So Lauriann, how many, just because I want to unpack that, because
sure.
That's really terrifying that it's something in the length of time that you're in college. So firstly, everybody, there's a comment section under here, and I want you to ask as many questions because this is about you guys. I want, if you've got questions or queries, don't just sit back and watch and wonder, because this is your opportunity to ask. Good morning, Belinda. I can see you on board. Thank you for coming up and sharing. And also, I want to do a quick plug for Q Academy, which I should have done really early in this piece. They are an education platform that you made me think about them when you started talking, because they have a really good structured way nowadays that, one, we look at our ergonomics, but two, we look at the biomechanical health how to set yourself up, how to place yourself to make sure that you're trying not to injure yourself. Probably more so nowadays than we ever did before. We were just thrust into it. But if you're interested in getting into massage therapy or upskilling from what we call Swedish relaxation up into myotherapy, or potentially an associate degree, which they're in the process of writing, then have a look on board for Q Academy. Lauriann, how many treatments were you doing from beginning to end that before you started feeling that?
Oh gosh. I probably was doing, practice maybe 3 times a week. And then all of a sudden in the externship, I went to 7 to 10
Oh,
uh,
yeah.
massages. And, I was under pressure also because I was working in a professional physical therapy clinic, and, you know, these were real clients. But I wanted to make the point that it is not unusual for people to get injured during their massage training. Uh,
Yeah.
in fact, 2 other people in my class of 30 also were injured enough that they could not practice afterward. And it's not because it was a terrible school. It's just that at that time, we didn't think about these things, and the school didn't think about these things.
Yeah.
So I got injured. I couldn't practice. I had spent all this money on school, and I started if something's wrong with me, I start looking for information to figure out, well, how do I treat this? Why did this happen, etc. Started looking for books, and there weren't any books. And so I developed a workshop. I started doing the workshop, which was very popular. And people kept telling me, well, you should turn the workshop into a book. So that's what I did. That was the first edition of Save Your Hands, which was edited by my brother, who is a medical doctor,
Wow.
just sure that it got everything correct. And it kind of, I don't mean to sound boastful, but it sold like hotcakes, as we say in the States.
Yeah.
It sold, or like petit pain, when we say in French. Because there was a real need for it. And I started writing I was asked, actually, my senior project at school was on musicians' injuries, which are similar. And I
Yeah.
had been a musician before. And that ended up on as a cover story on Massage Therapy Journal.
Yeah.
Uh, so, so then I started writing for pretty much all of the American and Canadian. I think I've also written for Australian publications. I also wrote a chapter for an Australian book by Elsevier called Fundamentals of Massage,
I,
but that was later. Do you know that
I
book?
got it down there. Yeah.
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 Yeah, well, the
Yeah.
chapter on injury prevention was me and my co-author, Rick Goggins. So anyway, that, I did all of that. Um, the book was published by a local publisher, and it just kept selling, but I couldn't practice, so I went ahead and did other things. And then in 2006, I always wanted to do a study on the prevalence of injury among massage therapists, because there were no statistics. In other fields like physical therapy, chiropractic, etc., there were statistics on this. In massage therapy, there weren't. So we worked with the American Bodywork and Massage Professionals, ABMP, and we got a very big sampling of people returning our questionnaire, which means that we could statistically say, okay, this is the percentage of people who get injured. We could extrapolate that out, and turned out to be very high. People with symptoms or injury was 77%. And they the questionnaire went out to people of all ages, of all levels. And that's not surprising because it's pretty much the same for physical therapists and chiropractors and physical therapy assistants. And so with that, I started working with Rick Goggins, who's a certified professional ergonomist, and his brother was a statistician, so we were able to do that. And shortly thereafter, Rick and I decided to write the second edition of Save Your Hands, which included ergonomics for the first time. It was 3 times as long as the first book and much bigger. It was really a totally different book. And that book came out in 2008. And
Did it sell hotcakes?
I'm sorry?
Did it sell like hotcakes?
Yes. Well, it did at first, but then there was the financial crisis. I don't know if you remember 2008, 2009, or the Great Recession, as they call it.
Yeah.
And the schools, I had hundreds of schools that used the book as required reading. And they all changed their business model because they wanted the tuition to be as low as possible. So they stopped including the book as part of the package when you signed up for the school. And so I lost a great many customers, and I was not able to continue to publish the book. And the book, I had somebody else took it over, and they published it for quite a while. But and again, I went on and did other things, which I won't bore you with. But recently, the book went out of print, and it was out of print for long enough that the rights reverted back to me. And now I have written I extensively revised and updated the book, of course, because 2008 till now is quite a long time. So things have changed, and I needed to, update the, some of the information. I was talking about, medical science looks at the musculoskeletal system differently now than they did in 2008. So I had to get a lot of updating done, and just did lots and lots of revisions. And so that's why the third edition is coming out. I hope within a month.
Okay, well, that's great. And we'll promote it, absolutely, everybody on the website.
Thank
And,
you.
it's super interesting because in the old days of learning, we were around the pure lever process. So when we would be treating people, it was basically deep tissue type massage. Nowadays, with our acknowledged skill sets, with so much more lighter work and positional releasing techniques and myofascial glides and passive pins, like all the other things, how you would have, I can only imagine that if you did another study through ABMP, that we wouldn't have up to 77% is a huge amount of people who have got some kind of injuries. I would hope to think that that number would be greatly reduced now because of our technique choices.
Well, I'd like to think that, except that the number was similar among physical therapists. And physiotherapists in at least in the United States, where we did the study, are usually have a doctorate in physical therapy, and so they use all of the techniques, and then some that massage therapists do. And even with their much fuller understanding and training, because if they do a doctorate degree, I mean, that's 4 years of university and then another 4 years after university. So it's many years of training. They still were getting injured. And also they don't spend, a massage therapist will spend an hour with a
Yeah.
client doing manual techniques, whereas a physical therapist will do manual techniques only some of the time. The
Mhm.
rest of the time, that's remedial exercise and, assisted stretching and things like that. But so they were also getting injured. So I don't know if I like you. I mean, I certainly hope so. I hope that maybe my work and my books have been helpful to people as well, and
Yeah.
given them ideas. And I know I've worked with hundreds of schools who've incorporated the book into their curriculum, and
Mhm.
even spas. I have worked with spas, and some very well-known spas in the United States. So, I hope that the information has gotten out there, has been disseminated. So I hope you're right. Um,
Well, no, I've seen any physiotherapist I've seen, I know that they have one depth of pressure. They
uh,
don't actually, there's not probably, because we have an hour, we have a greater length of time, and I see more people in the complementary health model will have like less is more, but in the allopathic, that physiotherapy, they are just bang, 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 and thumbs. I can just,
yes, yes, a lot of times.
So with the course, do you? I have a gorgeous friend, Lisa Belmore, who is a shiatsu practitioner and researcher, and there's a whole technique around hands for therapists and how to like what areas to work on to help with their own preventative medicine. It does your book go through different techniques? How do we work our hands before a treatment? What do we do after treatment? What do we do during the treatment? For like, can you take us through how I'm going to keep my hands healthy if I'm treating 6 people a day?
Yes. Well, first, there's a lot of information to understand. Uh,
Mm-hmm.
the things that get people injured, uh, as in any profession that is physical, people who work in manufacturing or who are, woodworkers, or any manual, heavy duty work. Um, they all have risk factors. And
Mm-hmm.
when I talk about risk factors, it's like we talk about risk factors for heart disease. If you smoked, if you're overweight, if you had a parent who had heart disease early, those are all risk factors. And there are a number of risk factors in doing the work that massage therapists and I should say estheticians also, because estheticians do a certain amount of massage. Um, so it's important to be aware of what those risk factors are. If you start out with that knowledge, you can be on the lookout for, am I doing any of these things that are increasing my risk of getting injured? So that's the first thing, is to be aware of what is it that gets us injured. um, and to adjust what you're doing, or be I talk a lot about awareness. you know um, I talk about it on a practical level, and also on kind of a, I don't know, for lack of a better word, metaphysical
Yeah.
level. Because I do talk about preparing yourself in the morning before you start working. Uh,
Mm-hmm.
and in the third edition, there is a ritual to go through to prepare yourself and to heighten your awareness. And the idea is to maintain that awareness while you work. One of the risk factors is that is working without a break.
Mm.
So one of the things I talk about is building little breaks into your work.
Mhm.
So, for example, um, you have run out of oil on your hands, and maybe have a holster, and you turn to the side for a moment. Some people turn their back on the client, so the client doesn't really see what they're doing. um, and and um, they pump a little more oil. So that's a little break. And if during that break they can, there tends to be some tension that builds up, and it's called, when tension builds up in your muscles, it's called static loading.
Mhm.
um, and it causes some amount of ischemia, so it reduces blood flow,
Mhm.
um, and it is a risk factor for injury. So if during that time you can take a couple of deep breaths, just it probably won't take more than a minute or two, but just to let some of that tension go out, so that when you go back to the client, even if it's 2 minutes later, your muscles have had a moment to relax.
Mm.
So that's also something that we tell people who work in offices or who work on the computer a lot and get these kinds of injuries from that, is to set their clock and to take a break every half an hour, to get up, walk around, take deep breaths, go outside, look at the sun. you know um, it's taking breaks is very important. It gives your body time to rest
Mm.
and to relax. So it helps with that risk factor of static loading from tension.
Right.
And that's especially y- young practitioners just out of school, um, tend to be, a little nervous, a little tentative, because they don't have that much experience, and it takes time to feel really sure of yourself in any new profession. So especially, and so young professionals tend to get injured quite a bit. So I talk about that. I do talk about self massage,
Mhm.
massaging, but not using your hands. For instance, massaging, using your forearm, massaging your own forearms.
Yeah.
Um, and of course, there's also stretches. We have a full conditioning program. One of the big reasons people get injured is that they think that because they're doing physical work, that they have the endurance and strength and flexibility that they need to avoid injury. But massage work in itself does not give that to you.
Right.
Uh, you need to have a special program that builds strength, builds endurance, builds flexibility, um, and that will give you those things so that you can more easily do your work. The work itself, it gives you it's more of a strain on your body than it is exercise. I would not consider massage work to be exercise, except there are people who do a very fluid kind of thing where they walk around the table a lot. Perhaps they're getting, more of a
Yeah.
cardio. kind of effect.
Kapuna, Lomi, they're perfect examples of
Yes.
using the whole of the body. So with the conditioning work, are we talking about like I'm going to be thinking specifically can I make my forearm flexors stronger, or my biceps, triceps, or my scapular stabilizers? What level are we bringing that in? My brain's looking at Belinda, who's up there. She came up from Victoria and she's up here for a few weeks, but she's been having terrible neural, like can't close fingers, carpal tunnel. What we found, well, it's probably more neck. So do you bring the neck, like because what do you do? What is conditioning?
We cover every part of the body that's involved in doing manual therapy work. So yes, we have neck exercises. We also talk about that, as you said, sometimes neck and even arm pain or paresthesias or things like that can come from either the cervical nerves coming through the vertebrae and the cervical spine, or from the brachial plexus, which is located roughly here.
Yeah.
So and there's something called double crush syndrome, where you have an impingement here that then it lowers the number of nerve impulses that are getting down to your hands. And that can be an issue. So you need to stretch out your arms, so you don't have all of that neural tension as well as muscular tension. And you need to be doing exercises to strengthen at the same time. But usually, in a good conditioning program, you're not just strengthening, you're working on, like I said, strength, endurance, and flexibility all at the same time, because you need all three of them. So, if I could be so bold as to make a recommendation for Belinda, I would want, her to try to do like a wall stretch. You put your arm or your hand against the wall and then you turn away from it. She may find that she has trouble doing that. That may cause pain. If the nerves are tight enough, that can cause pain. So then you back off. You just do as much as you're able to do and you work up to it. But that's, again, something that during the session, you can take a minute. Let's say that the client is turning over and getting comfortable, as they're now in supine position instead of prone. Take a second, put your arm against the wall, and do a little stretch for a minute. All of those little things add up. It's just like, they used to say, well, you have to work out an hour and a half every day. And now they say, well, you can do 10 minutes here and 10 minutes there and 10 minutes another time. And it's cumulatively the same thing as doing an hour all at once. So it's the same thing. All of these little breaks are really, really helpful. And of course, in between clients, you can do a lot more. So we do have specific things for the arm, the neck, the shoulders, the back. Core strength is very important, pretty much for everything and for everybody. It's the kind of shoes you wear. I talk about so much in the book. It's a little hard to condense it into to not just make a long list of things, but we do cover ways that you can prepare yourself, and certainly, before you start, doing some simple exercises like stretching your fingers out, or doing um, a thumb stretch. If you're using your thumbs a lot, if your thumbs are bothering you, there are small stretches that you can do. And of course, you want to warm up beforehand. So walk to work, or walk part of the way to work,
Yeah.
so that you arrive warm, not you don't start with cold muscles. So, I mean, again, there are many, many, many strategies, but those are among the things that I recommend.
Belinda was saying that she was doing that, those held stretches. Her hand therapist recommended dynamic stretching. So do we think about, because for me that's a little bit neural, and I'm kind of
It is neural, yeah. So by dynamic, it would be going back and forth, which
I
is
think
fine.
she's doing kind of like things that are like moving around, trying to keep. From memory, looking at the work that she was showing me the other day, is that she's the hands are together. She has a dodgy one, but I think that they're trying to do a connectivity, if that's right, Belinda, to make sure that there's it's a the dynamic. It's not isolated. It's actually more compound.
Yeah, I mean, I won't argue with her doctor. If that was recommended to her, she should certainly do it. The only thing is that in this position, you're really not stretching the entire arm. So, um,
And that is a valid point. I've always been a hand on a wall or something, and then rotate the elbow, like actually get some movement where your humerus is moving, you've
right,
got,
the glenohumeral rhythm.
yeah, we start getting capsular movement in there. But
Right.
we don't often look at strength and conditioning. We don't really do a lot of contraction, because that's not where we think. We think, oh, let's just stretch and relax and splint. But I think that
So,
you're on
yeah,
track there, Lauriann, that we probably should be doing, making the muscles stronger.
yeah, not necessarily the biceps so much, but yeah, I mean, there are quite, in my book, it's quite a long chapter, so there's a limit to how many. I mean, there are thousands of different exercises and stretches you can do. So, we got it down to a manageable number that most people are able to do. But there are many, many ways of approaching it. But as long as you keep in mind that you do need flexibility, you do need strength, and you do need endurance. So, and you need, something to warm you up, a little time on an exercise bike, a walk, something to, jumping jacks, something to warm up your tissues before you get started. You certainly don't want to start working with cold hands, cold muscles, because you need that blood flow to, keep everything healthy.
And
So,
not burpees, everybody. We're not ever saying burpees. They're like,
about burpees.
they're my most
I
hated.
can't do that.
That's the most horrible movement pattern. And I do love, I think the biggest thing that I'm going from what you're saying here is, are we mindful of that static tension? Because so many people are working with their shoulder blades, their trapezius up and running, or their heads naturally forward. That there's this hold position where it doesn't actually say, come back into a space where I'm acknowledging that I've got all of the skills that I can do to perform this. I don't need to be thinking in my head about what I'm doing.
Right. See,
Going,
there's that tension. Yes.
Yeah, exactly. And I'm going to flick over to a brief break and show a little bit more on how people can work within a great space with the Q Academy.
Okay.
One of these girls talks about this amazing lady.
My name is Jade Afu. I studied Cert 4 massage in 2014 and then went on to remedial in 2015. I was working in ASICS. I was retail, Lorna Jane. The real reason why I went and studied was my daughter was, she's been quite sick for about 7 years on and off. She's had a couple of chronic conditions. So I found it hard working in a job and having to leave because my children are sick or I've got to go to hospital or there's just so many things going on. For me, I needed another option. I've been set up for about 8 years now, working from home. Having a home business has been like such a blessing to my life. I don't think I could have done what I've done somewhere else just with my own circumstances. My life's very busy. I've got 3 kids. And this year has been a little bit different again because now I've got 3 kids playing sports every afternoon. So I do try, if I can, work in between school hours. I feel like you can make it work to your advantage. So you can either work as hard as you want and be stressed and all the things, or you can make it flexible.
And there's that flexibility in what you're going to provide. You have to think of yourselves first, therapists, because quite often what we do is we value everybody else, and then the dog, and then the tree, and then us last. So if you can think, I have got to be able to maintain my body, my biomechanics, my health, so that I can support everybody else. And I think that's our underlying. That's why we like doing this job, because we love to help and service.
We want to help people. Yes, of course.
Yeah.
But that's part of. I think part of the if we get down to a very basic level, that is part of. I hate to say it's part of the problem, because it's a wonderful it's a wonderful impulse to want to help people. But I have something in the book that's called out, where I say that it is it sets up the wrong kind of relationship to hurt yourself to help someone else. It sets up a kind of martyrdom, which is not healthy for any relationship. So yes, just like in everything, just like in any relationship, we always have to think of ourselves first. If you have a partner, you still have to make sure you're okay. Then you can take care of your partner. But was in the past so much emphasis on treating the patient, and very little, if any, talk about how are we reacting and what kind of energy and what kind of presence are we bringing into our sessions. If you're tight and tense and breathing shallowly, it sets up an unhealthy kind of energy in the room that is necessarily going to be picked up by the client. So it does help the client the more you can help yourself. By the way, I wanted to mention, just as a concept, because you were talking about the getting the neck and the shoulders into the right position. Generally, everybody spends most of their day, no matter what they do, with their shoulders internally rotated and their hands out in front of their body. If you type at a computer, if you do any kind of work, you are generally in that position. So your chest is caved in, your back is stretched out, and your head tends to move forward. So you get into this forward head position, which again has an effect on your nerves coming off of the cervical spine and into the brachial plexus. And the muscles in the back become weak and overstretched, and the muscles in the front of the body become tense and overly strong. So there's an imbalance, and of course the head rests on top of all of this. So that's basically what we need to. That's the main thing we need to counteract to not get injured, is that kind of posture, and almost everybody has it.
I'm presenting a 3-hour workshop on breath and brilliance on Saturday for Club Physio. And it's that whole concept of compressing down at C3, C4, C5, which is what happens in that forward pose, which is our exit points for our phrenic nerve. And then we reduce the capacity for proper diaphragmatic breath, which creates an inflammatory process back up to the neck again. And here we have this vicious cycle. And C5 also is part of the to T3, 4, and bang, we've got this slew of injury, reality,
potential injury,
because we haven't worked out that you can actually keep your body back and tilt. And there's your ergonomics again, isn't it?
That's right. Tilt at the hip, which many people don't know how to do. They bend at the waist instead of tilting. Right. So it takes concentration to make the difference between the two. But you're absolutely right. And when you're not breathing from the diaphragm, you're overusing the secondary breathing muscles like the scalenes. So those get very tight. And again, it's just goes on, and you're just in a bad situation that you need to get out of.
Lauriann, from your experience, what do you see, or what do you see most often with therapists? You talked about ulnar pain, and I actually had
that was me. Yeah, I had ulnar tendinosis on both hands. Radial is actually more common, but there's any number of.
What are the top 3?
The top 3. Nerve compression injuries in the neck and arm that may or may not turn into carpal tunnel syndrome. Carpal tunnel syndrome is not that common among massage therapists. You can get pain and paresthesias in some of the fingers that are innervated by the median nerve, but actual real carpal tunnel, unless you have been doing other things or you're pregnant. People who are pregnant tend to get carpal tunnel out of nowhere because of a buildup of edema. But I would say neck pain and low back pain. People bend, again, they bend at the waist, but even if they're bending at the hips, they bend over too much. Think about the way I was taught to do, the opening effleurage, to spread the oil on the back, is to stand at somebody's head, put the oil on your hands, and go all the way down to their, ilium, and then come back up. Now you have to, especially if you're short, you have to bend over quite a bit to do that. If you do that all day, in ergonomic terms, if you're bending consistently more than 20% of an angle, a 20% angle, which is like that, that is a risk factor for injury. So, so you end up with low back pain simply from doing too much bending over. They bend down to get, maybe their hot stone machine is on, a lower level. So they're bending to get the hot stones, or, something from a hydroculator, or, that's where you start getting into setting up your workspace to be ergonomic, so you don't have to be bending, so things are in a good position for your body. But certainly a lot of the movements that are sort of basic that we learn in the first few weeks of massage school, at least I did, involved a lot of bending over. So the neck problems come quite a bit from the fact that the head is about the weight of a bowling ball, 10 to 12 pounds. And people are looking down at their clients as they work all day long. Instead of learning to trust their palpation skills. Again, this is more common among people who are just starting out the first few years, until they realize that they don't have to be. You actually see more in your peripheral vision. You see better and you sense things better than if you're actually just staring at somebody. You may glance and see somebody wince or grimace or something because they're in pain. But that, you're holding up your, the muscles in the back of your neck are holding up this bowling ball to keep it from falling off your body all day long. And so, of course, you're going to have neck pain. The body was never meant to do that. So if I had to say the top three, I would say those would be the top three.
What about thumbs? Because you hear a lot of people complain of arthritis.
Yes, thumbs, de Quervain's thumb.
Was my next question on the how do you manage people? Because de Quervain's you're not going to create more rapid onset of de Quervain's with treatment, or I don't know. I thought it was just a job.
Well, if you use your thumbs quite a bit, I mean, especially if they're not really, how can I do this? In line. I can't show it. In line with the rest of your arm. Let's imagine my arm is extended.
Yeah.
So, if you're using it like this or some way that it's independent, that's the worst.
Okay.
That's just to use it where, or to, put a hand on top of it and help it glide along. But, the amount of pressure you're putting at the end of your thumb is multiplied, I can't remember exactly, but I think it's 100 times in the carpal metacarpal joint of the thumb. And that's why people get de Quervain's. So it's overuse of the thumb. It's with pressure and possibly in an awkward position like this, or like any number of awkward positions that people get into. Awkward positions are another risk factor for injury.
Yeah. I'm lucky that my thumbs don't I can't hyperextend, so I could actually use this and have never had a problem with it. But I do recognize that people who've got that extension, I'm not
flexible. So it just depends on, it's like a lot of things, you have more or less risk factors depending on your genetics, depending on the way, your particular body is built. It's one person will work for 20 years and never have a problem. And another person will work, for 6 weeks and get injured and not be able to continue. Yeah. It's so multifactorial that it can be difficult to figure out exactly what it is that's causing the problem. It's a lot of detective work, unless it's something obvious, like, yeah, I've been using my thumb and nothing but my thumb to do all of my massages. But usually it's a number of different things that are all contributing, and that you have to kind of weed out. But these kinds of musculoskeletal disorders are multifactorial. There's many factors that go into, and that's why one person can work for forever and never have a problem, and another person will, because their situations are just different, their ages are different, their musculature is different.
I wonder if we'll ever get to the stage that we'll do a pre-screen when people finish, like when you're in grade 10 or 11 at school and you're looking at your progression of what you want to do and go, all right, what are all those markers? And these are the like, not just your academic markers. I'm brainiac and I want to do architecture,
Right.
or you're too flexible, you're too mobile, you want to avoid jobs that are manual handling based.
Well, I think that I certainly encourage schools, when they're interviewing people to start a program, that would be a good time to do some screening. Now, it's a little bit hard because people can, sue you because, well, you said I couldn't do this, and but there could be a baseline of things. For example, if you're in terrible physical condition, you shouldn't be starting massage school. You should get in good condition and then start massage school.
Yeah.
If you never exercise and you sit around all the time, you shouldn't be going to massage school, because it's you don't have the physical condition for it.
And you strong and fit. People don't realize how fit you actually have to be as an endurance fitness to stand up for that length of time
Right.
in a forward flexion. It's and the endurance of muscles. I noticed that you. Where was I going on this? We talked about De Quervins. What do you see the most? You were a professional musician.
Yes.
I know in your background.
I started my career.
Yeah, founded and conducted the Washington Heights Orchestra. What is there a similarity with conditions that musicians have with their? I can imagine, like, I've looked after a lot of violinists and guitarists who are
Yes. Talk about awkward posture. It's nothing more awkward than having your head tilted and playing like this, where all of this is contracted, and you're crushing all the nerves on one side, and you're doing a lot of repetitive movement this way. I've actually done conferences for musicians on the same subject, injury prevention. It's very, very common among musicians of all kinds, to not just string players. And that's where I started. That was my senior project at my school. At my school, we had to do a paper, like a lengthy paper, like a thesis. So I was working with the Seattle Symphony at that time. It's just a very, very good orchestra. And so I had a lot of people I could ask. And I had been an orchestral conductor before that, so I was aware of the demands of all of the different instruments. People who play the oboe, they have to keep their thumb underneath. It rests on their thumb, the weight of the oboe, and it's surprisingly heavy.
Yeah.
So the thumb is static with weight on it, while they are, then fingering to play the different notes. So this is all very repetitive, but it's usually the thumb that gets it. So it's each instrument has its own risk factors, and it's a question. Again, they need to be in shape. They need to be exercising, and musicians really, it may look like, an oboist is just playing like this, but they're using, if they're good, they're using their whole body to play. But when they first start out, they may not be. So they may get injured during their training. But the same principles apply. So that's what got me. I was interested. I wanted to get out of massage school and work with musicians. I wanted that to be my specialties. And unfortunately, I got out and I couldn't work with anybody. But since the knowledge was the same and I had done all this research, I was able to then apply it to massage, and it's completely applicable. It's all the same risk factors. So it was very informative for me, and unfortunately, I didn't get to work with musicians except a couple of conferences that I was asked to do, like at the Boulder summer music conference and things like that. So,
any tips for massage therapists who have musicians as their client patients?
Oh, well, it's again, I mean, you have to kind of understand, you have to talk to them about, maybe ask them to at least mimic, or maybe even bring their instrument in if it's, carryable. It's not all of them are. And ask them, so what motions are you doing and how are you sitting? And, are you sitting straight? Do you tend to get into the forward head and the bent over position? You need to get a picture of what they're, spending 6 or 8 hours a day doing, because really good musicians are spending that amount of time. So that's the most important information, is what is their particular challenge with their particular instrument, and then you can address that. I mean, an oboist is not going to be able to do anything about the fact that they are holding the instrument with their thumb, but they can do strengthening of their hands and stretching of their hands before they play. And you can work on those muscles. And, that will likely be helpful. You bring, what's the word? Circulation into the tissues, and get maybe more mobility. Maybe it's gotten stiff, and because they're holding it with too much tension. Again, it's the tension, the static loading that causes injury. Maybe you can get them to see if they can hold it without the rest of their hand being so tense. Maybe you can have them, take some deep breaths while they're holding their instrument. Let the fingers, be less tense at the same time. Get them to, get into the habit of taking deep breaths as well. For a woodwind instrument, you're taking deep breaths, but even if you're not playing because they don't play through the whole symphony, for them to be concentrating on deep breathing and relaxing their body. And, it's all counteracting the things that are causing them pain and tension. Tension is you wouldn't think it was such a big problem, but it really is.
A closing question: if you've got for therapists, is there a closing routine? Like, I've finished my patients for the day, I've written up my paperwork. Is there a last sequence that you suggest that they can apply before they turn off their clinical brain and come onto their private brain?
Yeah, I do. We have suggested routines that they can do to vary what they work on every day. And certainly at the end of their day, they should be taking deep breaths, stretching, getting out into the sun, since many massage therapists are working in a darkened room. And, just being out in the sun is refreshing and makes you relax. Make sure that they have something, they're not just going to get into their car and, go off and then sit all evening. They need something. They need you need a warm up and you need a wind down. So we do talk about that in the conditioning program, chapter 11 of the book. So yes, they do need to counteract whatever, again, it's the awareness, developing awareness.
Okay.
Take a deep breath and figure out, where in my body do I feel tension? Where do I feel tight? Where do I possibly feel pain? And, stretch those out, um, get some movement in, even if it's just, moving the arms around or just rolling the shoulders back. That's a wonderful exercise. It's very simple, but it actually activates a lot of different muscles, and can help the neck as well as the shoulders, which of course then it helps the arms. So
And
yes,
they're great salient words. I think and that's probably where we should kind of, as therapists, put a big sign saying awareness, tension, breath, and there's part of your closing sequences. So, Lauriann, the best way for people to find the book is to go on your website?
yes, at this point, because the book has not been published yet. Publishing books is different these days than it used to be. It used to be you printed out thousands of books, and then you had them available, and you could do a pre-sale of them. I am not quite finished. We're finishing up some details on the book, including the cover and the index. So until it is absolutely finished, I cannot load it up to Amazon and other distributors, where I could give you a link to buy the book.
If people want to get some information, thank you, Tracy. Loved all this information. I wish this book and the information was around years ago. I agree.
Was
well, yeah, and aware to Aussies.
right.
I'm aware. So if people put their names, have you got like a section, like a comment section on your website?
It's being created next week. There will be a section where they can put in their name and their email address, and we will let them know when the book is available. If they want to just contact me in the meantime, I'll just make a note about it. They can contact me at hello@illuminatepress.com. That's the name of my publishing company. Illuminate, ILLUMINATE, press, all run together.com. And hello at Illuminate Press. And I'll just make a note. And we're still in the final stages of putting the website together. We've got about a month before the book will come out, but it will.
Yeah, and last month I interviewed Robert Libby on his ligamentous referral pain, and his book is doing exactly the same as yours. So, Lauriann, I'll have you and Robert's books. I'll be putting them both up on my Facebook groups and as many places with links to get to both of you.
Thank you so much. I appreciate that. I do
Oh,
want I have worked with Australia in the past quite a bit. There were a number of schools, and there's in New Zealand also, there was the Kasha Books was a distributor of mine for a long time. I don't know if you've heard of them. But
we've got Human from Terra Rosa, and he's very good at promoting.
oh, right, Terra Rosa. I'm glad you reminded me of them.
With them.
And then, you know, that chapter that we did for the fundamentals of massage, the Australian massage book, which is quite a good book. So
thank you so much.
I want to work with you with Aussies.
Yeah, no, I'm so glad we can help out. Don't forget, everybody, that we've got Q Academy. If you're interested in any more upskilling from remedial massage to myotherapy, or getting some information from myotherapy to the potential associate degree, jump on their website. So qacademy.com will be the easiest way to get them, or maybe .com.au, but have a squiz in there. Next month, I'm hoping maybe to get physiotherapist Paul Wright on to have a chat about marketing and how we can improve just our general presence in the area. Not sure if I'm getting, because I'm also going sailing for a couple of weeks in Tahiti with some friends.
You.
Yeah, I know, very excited. But watch this space, tell your friends, share the information, and we will see you all, let you know what's happening for either end of September or beginning of October. But thank you again, everybody. Thank you, Lauriann, and we'll
My pleasure. Thank you, everybody.
Bye.
Bye.